Three patients from violent past have gone missing from the Center for Addiction and Mental Health this month alone now. While two of them were located, the third ended up fleeing the country. Tonight, CAMH announces yet another review as criticism over security remain.
That's definitely concerning. You never want to hear something like that. So, yeah, I don't know. It's scary that it's happening right here, too.
Residents in the Queen West and Ossington neighborhood have heard about three different police investigations for missing CAMH patients since early July. The first and perhaps most shocking is that of Ziban Chong, the 47-year-old patient who was reported missing but is no longer in the country.
How does a person get to leave the country under those types of circumstances?
That's the million-dollar question, especially considering his past.
We don't have information on how he was able to leave the country.
Chong was found not criminally responsible for the gruesome murder of his roommate back in 2014 because of his mental illness. But was he a danger to the public? The police reports say he was low risk when he was out on a day pass. Documents from the Ontario Review Board assessment said otherwise and indicated the 47-year-old had desires to go be with his mom in China. We asked about that discrepancy today.
During treatment over several months and sometimes sometimes years, there is an increasing ability of individuals to safely leave the environment, first accompanied and then with greater levels of freedom, and he was on that process.
A CAMH spokesperson said the ORB review was standard and based on Chong not being medicated, while the facility's low-risk designation was based on the 47-year-old's current condition, that he was medicated and compliant, that he had no history of disappearing or going off his itinerary. Earlier this week, police were able to locate a 27-year-old man after he went missing on an accompanied day pass. CAMH says he too was an NCR patient since he was 19 years old, but he had fewer privileges than Chong, and in the past recent ORB report was deemed a flight risk.
I understand how events of the last number of months have caused people in the community to be concerned about our ability to effectively manage that balance.
Do you believe that there is a gap between CAMH and a gap between Toronto Police?
No, we have excellent relationships with the police.
Meanwhile, CAMH says it has added additional clinical staff and security. Both the province and police have also launched their own investigations. In a brief media conference since Chong's disappearance, CAMH announced it has launched yet another review, this time an external probe of passes and privileges for forensic patients, including the 182 under NCR designation. That will also involve international experts.
This will allow a team to undertake the level of detailed examination that ensures a robust recommendation set, and it will allow us to enact changes as expediently as possible in order to rebuild trust in our program and in our organization.
CAMH says it would like to complete the review by the end of the year. Near Queen West and Ossington, I'm Faiza Amin for City News.